Hi, so I'd like to give you some post-liposuction instructions. And this is for liposuction, whether we did liposuction around your neck, your abdomen, your flanks, your chest, lateral thighs, etc. It's pretty much the same thing. Number one, there are several incisions around your body through which were portals for which I use the liposuction cannula to remove your fat. It's very common in the first 2 to 3 days. Even though we have little dressings over those little incision sites, you're going to ooze. It's normal. Don't be frightened if you see some red stuff coming out. It's probably a little bit of blood, but a lot of the tumescent fluid that we put in to do the liposuction. Having said that, think about where you're going to be resting for the next 4 days after having your surgery. Meaning that you're definitely going to be in your bed. You'll probably get tired of being in your bed, so you're going to probably hang out in a comfortable chair. And you're probably going to go into the kitchen. So think about the furniture that you're going to be sitting on. Every one of those pieces of furniture where you're going to be sitting is a probably good idea to put a beach towel. So when you sit down on the chair or the couch, the beach towel is between you and the piece of furniture. When you go to bed, put a beach towel between you and your sheets. And on your bed, put your worst sheets that you have and your worst pillowcases, so that if you do get a little blood on those pillowcases and sheets, it's not a big deal. You'll wash them, but you're not going to feel terrible that if you took your 200 thread Egyptian style sheets, they're going to be destroyed because of a little bit of blood. So put the worst sheets that you have on your bed. Some of you have had children that are still just, growing up. Maybe you have that liner that you put on between the sheet and the mattress, so that if there is a little blood that's on the or like when a child maybe wet their bed, you put that liner on so that the liner would protect the mattress from getting wet. Well, similarly, if you're going to find a little bit of bleeding, if the blood goes through the sheet, you don't want to stain your mattress. And I can't believe how expensive mattresses are these days. So some little protection there is not a bad idea. So if you have a liner, put that on. We're only talking maybe about a week of your life that you're going to have to do this. But when you're sleeping at night, resting during the day, it's probably a good idea to, again, put that towel to line to prevent some of the bleeding in that area. So that's statement number one. Statement number two. You're going to obviously feel really grungy following your surgery, because I like showering every day, and I suspect you like to do something like that also. So I'm perfectly okay with you showering every day. I used to tell patients all the time in the first 2 days when we did a lot of liposuction, that garment that we put you on was very uncomfortable and difficult to take off. I would tell them to shower with the garment, they take a blow dryer and blow dry themselves with the blow dryer. If you feel that's something you don't want to do, and you feel you have enough flexibility and range of motion and not too much discomfort, then I advise you take the garment off, take the little band-aids or dressings over all those incisions off, and then take a lukewarm shower. Now, when you take a lukewarm shower, start off sitting down if you have a stool. Get accustomed to the temperature of the water. Don't make it very, very hot. Make it lukewarm. And then stand up and do your showering. Over the incision sites, try not to use soap. Just let the water kind of roll over that area. After you've taken your shower, get out of the shower, blot the areas dry, put a little bacitracin on a band-aid over each one of those little incision sites, put the garment on, and go about your business. Those are my recommendations for your post-op bathing instructions and the post-op chilling out couch potato instructions for your for your liposuction. Thanks.